Today, we're taking a closer look at something pretty practical.
Mm-hmm.
It's about understanding a structured way to assess, acute changes around a stoma, those times when something suddenly looks or feels off.
Yeah, actually, it lays out this framework, a questioning framework.
And the source presents this systematic method for doing that assessment. It shows a nurse using this specific questioning framework, I think, with a patient named Mr. Smith in the text.
Yes, that's the example used.
Mm-hmm.
And it uses those letters OPQRST to guide the conversation, the assessment.
O-P, got it. I always find mnemonics helpful. They sort of stick in your head. Shall we walk through it letter by letter, using the specific questions from the source?
Sounds good. Let's start at the beginning with O.
Okay, O. What's the focus there?
O is all about onset. So basically, when did this whole thing start?
Right, the timeline.
Exactly. The source gives examples of questions like, when did you first notice this increased soreness around the stoma?
Okay.
Or, when did you first notice the stoma's color looking different?
Makes sense. And it also mentions something about how it started, not just when.
Yes, that's a key part. The nurse asks, was this change sudden, or did it happen over time?
And why is that important, the sort of pace of the change?
Well, think about it. A really sudden change might signal something acute, like an immediate event happening. Where something that developed more gradually, say over a few days, might suggest a different underlying issue. It helps narrow things down right from the start.
Got it. So O is the when and the how fast. Clear. What's after O?
Next up is P. This stands for provoking or palliating factors.
Provoking, like what makes it worse. And palliating, what makes it better.
Precisely. What triggers it, or what gives some relief, even temporary relief? The source suggests questions like, does anything make this soreness better or worse?
Okay.
And does moving around or any specific activity affect it?
That's interesting, connecting it to daily activities. So you're looking for external triggers or maybe even simple things the person might be doing that help or hinder.
Exactly.
Oh.
It helps link the symptom to, real-world actions or situations.
Yeah.
Did they try anything? Did it help? It connects the subjective feeling to something more observable.
Okay, that makes sense. Let's move on to Q. This one's for quality. How does quality apply here, especially with soreness or color?
Yeah, quality isn't about judging it. It's about describing the nature of the symptom. What does it actually feel like?
So not just it hurts, but how it hurts.
Right. The source gives examples like, how would you describe this soreness? Is it sharp, dull, or maybe cramping? Getting that specific description.
And what about for the color change? How do you describe the quality of a color?
Well, the nurse asks directly, can you also describe the color of the stoma for me right now?
Ah, okay. So getting the specifics.
Yes. Is it bright red, dark red, purplish, dusky? That kind of detail. Because a sharp pain means something different than a dull ache, right?
True.
And a specific color change can point towards different issues, maybe circulation, maybe irritation. The source really emphasizes getting that precise description.
Yeah, you definitely need that detail to figure out what might be going on. So, okay, we know what it feels like or looks like. Where does R come in?
R is for region or radiation. Basically, where is the problem and does it spread?
Location, location, location.
Pretty much. The questions are direct, like, can you point exactly to where this soreness is on your belly?
Pinpointing it. And the radiation part, does it travel?
Yeah, that's covered by asking, does it stay in one spot or does it spread anywhere else?
Okay.
Knowing the exact location and whether it radiates is, well, it's fundamental for assessing lots of health problems, not just stoma issues. It maps out the physical extent.
Right. Essential information. Okay, OPQR. Next is S. What's S standing for?
S is for severity. This tries to quantify how intense the issue is, or maybe how worried the patient is about it.
Ah, the classic pain scale.
Exactly. The source uses that familiar 0 to 10 scale. On a scale of 0 to 10, where 10 is the worst pain imaginable, how would you rate this soreness right now?
Okay, that's straightforward for pain. But how do you gauge severity for something like a color change, which might not hurt?
That's a good point. The source shows the nurse asking something slightly different. How much of a concern is the stoma's color change to you?
Ah, so it's gauging the patient's level of worry or perception of seriousness?
Precisely. While the pain scale gives you that subjective but sort of measurable data on discomfort, asking about concern gives you insight into the patient's perspective on how significant they feel the change is. And that's really important information, too.
That's clever. A different way to quantify for different types of symptoms. Okay, nearly there. Last letter is T.
T covers timing or treatment. So it looks at the pattern of the symptom over time and also what, if anything, has been done about it.
Timing.
Yeah,
Like, is it constant or does it come and go?
exactly that. The source has questions like, is this soreness constant or does it come and go? Understanding the pattern always there, intermittent, related to certain times of day can be a clue.
And the treatment part, finding out what they've tried.
Yes. Like, have you taken any pain medication for it? And crucially, if so, did it help this specific soreness?
Right. Did the intervention actually work?
Yeah, it tells you if standard approaches are effective, which helps guide the next steps. And importantly, it also establishes a baseline. The nurse asks, when was the stoma last its normal color?
Comparing to the usual.
And also, when were you last checked by a nurse or doctor? Context is key.
Okay, just to recap this deep dive, thinking about the source material, we've seen how a framework like OPQRST offers a really solid guide for assessing acute changes, specifically using the stoma example.